thank you, Pratish, for that really practical approach to outbreak investigation rather than just panicking. So it's good to have a logical approach. We're now going to move on to our next speaker and our next topic, which is Zika virus in the Americas. Where are we now? It's been a little while since we've been hearing about Zika virus, but it presumably hasn't gone away completely. To tell us more about that is Dr. Lisa Brumble, who is at Mayo Clinic in Florida, a nice warm place compared to the weather we've been having in Minnesota. So Dr. Brumble got a bachelor's in biology and chemistry, then went to medical school in East Carolina University. She did her internal medicine training at Vanderbilt, followed by infectious disease fellowship training. She, as I mentioned, is now at Mayo Clinic, Florida, practicing general ID and transplant ID. One of her areas of expertise is infections in immunocompromised hosts, especially fungal infections. And a fun fact about herself is she enjoys traveling to Hawaii, perhaps, bird watching, and spending time with her dog. Lisa, thank you.
Well, I want to thank Dr. Pritt and Dr. Verk for inviting me, and it's wonderful to be in Hawaii with you all. This is my first trip to Hawaii. So I have no conflicts of interest, and here is my question. If a man lives in or frequently travels to any area with risk for Zika virus and becomes symptomatic, how long should the couple wait to conceive? Is it 2 months, 3 months, 6 months, or 12? Good job. Everyone knows that the recommendations had changed then. It's not forwarding. Here we go. Okay, so the objectives of my talk are many, but we're going to talk about the epidemiology, clinical manifestations, management, and prevention of Zika. We're going to discuss the diagnostic testing. We're going to review some vaccines that are in development, and we're going to review recommendations for pregnant women and possible Zika virus exposure. So as you all probably know, Zika virus is a single-stranded RNA virus that's a member of the flavivirus genus. It's closely related to dengue, yellow fever, Japanese encephalitis, and West Nile virus, and it's primarily transmitted to humans by Aedes mosquito bites. Infection with Zika virus is nationally notifiable. Zika virus was first isolated from a rhesus macaque that was